917 oh 7000 917 917. You're going to send a text or WhatsApp message to 070 317 56537 070 317 56537. I have our doctor with us this morning, and we're going to be talking about urinary tract infection in children. Urinary tract infection in children. That is our topic for today. Yes, you can also watch us live on our YouTube and Facebook. Just search for it, WFM 917. You can also watch us from there, or you can also log onto our website at WFM917.com and listen from any part of the world. Good morning. Thank you for joining us on Radio Doctor this morning. Yes, we have Dr. Olufinola Akinola, who is a consultant pediatrician, and she's going to be the one talk to us about urinary tract infection in children this morning. Hello, good morning, doctor.
Good morning.
Good morning. How are you doing this morning?
I'm glad to be with you. Thank you.
Thanks so much for joining us, and I hope you had a very good weekend.
Yes, thank you.
Yes. Welcome. And since we've been actually wishing everyone a happy Valentine's Day, I'm going to do the same to you as well. Happy Valentine's Day.
Happy Valentine's. I hope you have a nice Valentine's Day.
Yes, so far so good, Ma. Thank you so much, Ma, for joining us. All right, so we're going to be talking about urinary tract infection in children. My special guest is Dr. Olufinola Akinola, consultant pediatrician at St. Ives Family Hospital. Yeah. So first of all, when we came across this topic, first of all, I was taken aback a little bit because a lot of people would not really think that children actually can actually get urinary tract infection. Usually, we think it's usually just for adults. Adults usually get it, but knowing that children also can suffer from this disease makes it a much more interesting topic to talk about. So, what is urinary tract infection, first of all, and we'll go on from there.
Uh, Good morning, all. Glad to be with you this morning.
Thank you.
Urinary tract infection, infection along the urinary system. If you have infection that is along the urinary system, uh, that is when you say that the patient had urinary tract infection. The urinary system consists of the kidneys, the two kidneys, the bladder, the urethra, and all these are part of the body that are involved in the urine production. So I mentioned that it involves the two kidney that filter blood and extra water to produce urine.
Okay.
Consists of two urethras or tubes that take urine from kidneys to bladder, and bladder that stores the urine until it is removed from the body,
Okay.
and the urethra or tubes that empties the urine from the bladder to outside the body. These are the uh, urinary tracts. Urinary tracts. Or urinary system. So any infection that occurs along this site, known as urinary tract uh, infection. Children can develop urinary tract infection when bacteria enter the urinary tract from the skin around the anus and travel up the urethra into the bladder, then enter the knee, then to the bloodstream. So these are what describes as urinary tract infection.
Now, is it very common among children? Does it happen to children a lot?
Yes, it's common among children and affects male more than in young children.
Okay.
Affects male more uh, than the female.
Okay. So
But in
yes.
older children, then they affect uh, female more.
It affects females more.
In older children.
Okay. So why does it affect female children more than male children?
It's because of the nearness of, the looking at the anatomy of the genital tract affects the urinary opening for the female nearer the anus, because of the contingencies of these structures, bacteria can easily pass, fecal matter from the inner area
Okay.
and easily enter into the urethra, causing infection in
Okay.
female.
Okay. Okay. Yes. So, my question is about this UTI infection in children. Is that for parents? For parents, what are the signs and symptoms to watch out for? Because you might have some kids that are very so young that they might not be able to explain to you how they're feeling, and they might have a UTI, a urinary tract infection. So, how are you able to know if your child has symptoms or signs that is from a urinary tract infection?
Um, Symptoms of urinary tract infection varies depending on the degree of the infection and the age of the child.
Okay.
In infants and very young children, the symptoms may not really be distinguished from other causes of fever, or because they cannot, tell you that this is exactly what is happening to me. So these children may present fever. I mean, in younger children, those that cannot talk to say specifically this is how I'm feeling.
Yes.
They may present with fever, poor appetite. Some of them may be vomiting. They can even present with diarrhea, irritability, and feel.
Yes, we lost connection there with Dr. Lufunola Akinola. We'll reestablish connection. This is Radio Doctor on WFM 91.7, Nigeria's first radio station for women and their families. This program is the first free health consultation program where real doctors advise real people. Is Nigeria's first specialized radio health program on this great station, WFM 91.7. We're talking about urinary tract infection in children, and Dr. Akinola has been sharing with me what urinary tract infection is, the signs and symptoms to watch out for, and she'll definitely explain more in detail as soon as we reestablish connection with her. Thank you for staying tuned to WFM 91.7, Nigeria's first radio station for women and their families.
Radio Doctor and WFM 91.7 every Monday from 10 to 11 a.m. brings you medical experts specialized in children's health.
Studies have shown that children that were abruptly stopped from breastfeeding tend to have some emotional trauma.
Call in to get free consultation on children's health on 07000 917 917 or 090 256 25455. You can send in questions, cases, and related contributions on social media, Facebook, Twitter, and Instagram at WFM 917. Text and WhatsApp on 070 317 56537. You can listen live online at www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7, the voice of women.
Really nice. I take you on another. Without doctor's prescription, Montenma, all on doctor's attention. If you need solution, Montenma. Much is given, much is expected. Yeah, Lord. Live love and stay strong. Rock it out when you know one. Live love and stay strong. Rock it out when you know one. You was at the day. Aláboyún ẹ múra o. Bó bá ṣe bí ẹni bá rẹ̀, àbí ojú máa ṣú. Aláboyún ò ní bómi náà tó lé lọ, ọ̀dà òsì ní ìtú. Oníkéde bá lọ̀rọ̀, àgbo ṣe dáadáa bá láboyún ṣùgbọ́n. Ẹgbẹ́ máa ṣe kó wọ́n sílẹ̀ o. Ẹ ò gbọ́dọ̀ tó kù o, ẹ ṣẹ̀ṣẹ̀ tó bí o. Live long and stay strong. Rock it out when you know one. Live long and stay strong. Rock it out when you know one. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ẹ̀fọn tó gbòòrò àtún lọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kọ̀ọ́ lè gbà kọ́sà fún tọkọ. Cleanliness is essential. Fertilize your potential. Understand the times and your initial. I should be kind, I should be good. I you wanna live love and stay strong. Rock it out when you wanna live love and stay strong. Rock it out when you wanna live love and stay strong. Rock it out when you wanna live love and stay strong. Rock it out when you wanna. Without doctor's prescription, Montenma, all doctor's attention. If you need solution, Montenma. Much is given, much is expected. Yeah, Lord. Live long and stay strong. Rock it out when you know one. Live long and stay strong. Rock it out when you know one. You was at the day. Aláboyún ẹ múra o. Bó bá ṣe bí ẹni bá rẹ̀, àbí ojú máa ṣú. Aláboyún ò ní bómi fún ẹni mọ̀ràn. Ìgbà tẹ̀sán ìlera lọ́wọ́. Ìlera lọ́wọ́. Ìgbà fún ẹni mọ̀ràn. Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ẹ̀fọn tó gbòòrò lọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kọ̀ọ́ lè gbà.